Thank you so much, Amy, for those remarks and the introduction, and thank you to everyone for being here today. Can you hear me okay at the back? Good. Okay. I feel truly excited and honored to host this afternoon's crucial discussion, and I've been overwhelmed by the incredible level of enthusiasm and support that this event has received. And none of this would have been possible without my executive assistants from Toronto, Rally Chakarova, who is here today, and my staff, Caitlin, Sarah, Andrea, and Agnes, who's doing a co-op in our office. They have dealt with millions of calls and emails, and whoops, that's probably a politician exaggerating, sorry. And they have organized everything that you see here today with care and efficiency, so thank you to my staff. I also want to thank the Queen's student volunteers who have supported my office staff, and of course, thank you to Queen's for your commitment to excellence. Your students, staff, and faculty are such a positive influence in our community. Please join me in thanking them all. Thank you to Amy for agreeing to be our MC. Amy is a former Toronto police officer. She has worked both, as she has said, in the federal constituency office and in my office, and she is now a teacher of police services at St. Lawrence College. She may be small, but she's mighty, and in order to answer many questions as possible, she will be keeping us to a strict time schedule so that we can hear from as many of you as we can. To our speakers, Dr. Ruth Wilson, Dr. Ruman Milev, Dr. Mike Condra, Heidi Penning, Ben Gooch, and Sergeant Craig McFarlane, thank you for your time from your busy schedules to be with us on this absolutely gorgeous day today. Thank you for sharing your knowledge with us, and more than everything, thank you for your work on mental health in our community. I would like to start out today by recognizing and acknowledging our Haudenosaunee and Anishinaabe sisters and brothers who share their traditional lands with us. Thank you all for coming here this afternoon to learn more about mental health concerns and about ways in which we can reduce stigma associated with mental illness. All of us have been touched in some way by mental health challenges, whether it's a friend, a coworker, a family member, or ourselves. In fact, 1 in 3 Canadians will experience a mental health issue during their lifetime. In my 7 years in the federal office, I saw on a daily basis how challenging circumstances can be for those whose lives are affected by mental illness and for their friends and family. For some numbers, more than 2/3 of mental health problems have their onset during childhood or adolescence. 3/4 of Canadians feel uncomfortable talking to their employer about mental illness for fear of facing discrimination or dismissal. Suicide accounts for 1/4 of all deaths among 15 to 24-year-olds. And as a mother myself, I cannot imagine the pain that parents must feel at such an outcome and the anguish of the circumstances surrounding a situation where somebody has committed suicide. No words can capture that loss. I think that these statistics alone clearly illustrate why we are focused on early identification and on mental health in the classroom and the workplace. We have an excellent panel of speakers today with more than 5 decades of experience between them, so I will allow them to delve deeper into the discussion topics very soon. I would like to talk about why this conversation is important for our community and what we hope to accomplish today. Let's consider some more statistics that I think are very clearly illustrate what we mean when we speak of the stigma associated with mental health conditions. According to the Centre of Addiction and Mental Health, only 50% of Canadians would tell friends or colleagues that they have a family member with a mental illness, compared to 72% who would discuss a diagnosis of cancer. 42% of Canadians are unsure whether they would socialize with a friend who has a mental illness, and 55% would be unlikely to enter in a spousal relationship with someone who has a mental illness. 46% of Canadians think people who use the term mental illness as an excuse for bad behavior. Stigma is a negative stereotype. Stigma and the discrimination that flows from it is a reality for many people living with mental illness, and they report how others judge them is one of their greatest barriers to a complete and satisfying lifestyle. Tragically, stigma and discrimination only adds to the burden of the condition. It presents a serious barrier not only to diagnosis and treatment, but also to acceptance in the community. Under the Ontario Human Rights Code, every person has a right to equal treatment with respect to services, goods, and facilities without discrimination due to their identity. So today, it is my hope that in listening and learning, we might all go some way towards fostering a culture of acceptance and inclusivity for people with mental health conditions. We can start to recognize the attitudes and actions that support negative stereotypes and stigma and explore ways in which we can intervene to promote a change in the language we use, and that starts with each and every one of us. I'm thrilled that so many of our frontline healthcare professionals took the time to be here today and answer some questions and provide information on their services. There will be an opportunity to mix and mingle towards the end, but I want to take this opportunity to introduce all of you now. Please raise your hands when you hear the name of your organization and be recognized for your dedication and commitment. Providence Care. They put the excellent lived experience videos we played earlier and Voices, Opportunities, and Choices Employment Club, or VOCEC, which provides employment opportunities for consumers of mental health. Thank you, Providence Care. The Innovative Patient Intensive Transitional Treatment Program at KGH. Where are you? The back, there you are, thank you. Addiction Mental Health Services, KFL&A, who just completed a tremendous integration process to better serve their clients. Where are you? Peer Support Southeastern Ontario, the only consumer survival organization in the Southeast. The Kingston branch of the Canadian Mental Health Association. The Limestone District School Board. Algonquin and Lakeshore Catholic District School Board. Thank you. Pathways for Children and Youth, Kingston. Where are you? Kingston Community Health Center. And Circle of Wellness and Kingston Drum Circle. And I'm not sure if Four Directions is here, but they we're trying to attend, so hats off to Four Directions and their work. Jack.org, Queen's Chapter. Different Strokes Art Group. Where are you? And last but not least, Kingston Police Services. Creating better access to these kinds of important community services is a key part of Ontario's mental health and addiction strategy. Ontario is also providing $138 million over 3 years through the 2014 budget to community service agencies to help increase access to strategies such as peer support groups, treatment programs, and crisis and early intervention initiatives. However, we know that there is much more work to be done, and we cannot do it alone. I will continue to advocate to the best of my ability on this subject. I do believe, however, that the increased funding is indicative of a cultural shift in how our society views and regards those living with mental health conditions. Frontline service workers, those living with mental health challenges, and their support networks are in the best position to identify priorities and gaps in access, quality, and coordination of mental health care in our community. Political will grows from recognition of the severe consequences of inaction for our children and youth. This is how our advocacy and intervention does create the condition for positive change. Let's continue to work together. Thank you once again for being here today, and as we go along throughout the day, please help yourself to refreshments at the back. Make yourself comfortable. This is not school. You can walk around. But before our panel speakers begin their presentations, it's my pleasure to introduce a special message from Honorable Eric Hoskins, the Minister of Health and Long-Term Care. Regrettably, the Minister was not able to be with us today, but as this subject is near and dear to his heart, he prepared and sent the following message for today's event. Thank you so much.
Good afternoon, and thank you, all of you, for participating in today's Mental Health Town Hall. And thank you, Sophie, for hosting this important discussion. Sophie Kiwala has been an incredible advocate on behalf of your community, and we're so thankful to have her here with us at Queen's Park. I know that Sophie is passionate about issues concerning mental health, and that she's been working hard to meet and work with many mental health organizations in your community, as well as individuals who have been personally touched by mental health and addictions challenges. I know that the discussions today will be extremely thoughtful and well-rounded. Our government is committed to improving mental health and addiction services, and we've made a lot of progress over the past few years. Last November, I announced the next phase of Ontario's comprehensive mental health and addiction strategy. This phase will focus on supporting the transition between youth and adult services, improving the quality of services for Ontarians of all ages, and interventions to promote workplace mental health and peer supports. I've appointed a Mental Health and Addictions Leadership Advisory Council made up of members representing diverse sectors that work on mental health and addictions issues, including, importantly, those with lived experience. I met with the council at their first meeting on February the 6th, and they're already starting to work and support and expand the delivery of coordinated, timely care. They will also review our current mental health services and improve the way they're being delivered by creating an evidence-based scorecard to evaluate their impact. I recently announced that the Ontario government is investing $138 million over the next 3 years in community mental health and addictions programs. I firmly believe that the best, most innovative ideas often come from the community. So I'm eager to hear from Sophie about the results of your town hall today. I wish you all a fruitful discussion, and thank you again, Sophie, for bringing all these voices together. Thank you.